I am so honored that you guys could join us today. And actually, even more honored, I have my amazing friend here with me, Dr. Roseann. And she has written this amazing book about parenting kids who are struggling, because our children today are living in a world of chronic stress. I mean, they're turning the news on, there's chronic stress. They're going to school, there's chronic stress. They're living outside of their norms. That creates chronic stress. And that is, taking a toll, not even on adults' mental health, but it's taking a toll on even children's mental health. So because where children's mental health is on a rise, where 1 in every 6 American children have at least one neurodevelopmental disorder like autism, ADHD, dyslexia, specific learning disorders, communication disorders, sensory processing disorders, and so much more. And there's even a rise of something she's going to talk about today called PANDAS and PANS. And so along with like autism, they say currently, it's crazy. They say if we continue at the current trajectory, 1 out of every 4 children will have autism by 2033. That's craziness. ADHD has increased 167%. And I mean, the amount of children that are on antipsychotic medications is craziness. And sometimes even we can even say criminal in some situations, because a study published in the Journal of American Academy of Child and Adolescent Psychiatry looked at over 300,000 antipsychotic prescriptions filled by privately insured children. And antipsychotics were causing all of these chronic health conditions, even despite, because this study looked at those children, more than 300,000 between 2007 and 2017, between 2-year-olds to 7-year-olds. Craziness.
Yeah.
If you ever read the actual black box warnings, it's really, really scary. These children who take antipsychotic medications have increased risk of weight gain and diabetes and high cholesterol and cardiovascular disease and unexpected death. And, it's really, really scary. So I'm so honored today to have with us in the house Dr. Roseann. She is a mental health trailblazer. She's also the founder of a global institute of children's mental health, and Dr. Roseann Associates, and who is literally changing the way we view and treat children's mental health. Her work has helped thousands reverse the most challenging conditions such as ADHD, anxiety, mood disorders, autism, learning disabilities, Lyme, PANDAS, PANS, OCD, all by using these proven holistic therapies such as neurofeedback, psychotherapy, biofeedback. She is also a best-selling author of the first ever book on teletherapy activities for children and adolescent therapists, like Teletherapy Toolkit, and her new book. Can we show that beauty? Where's that beauty?
It's right over there. Bestseller. Yeah.
Her new book, It's Gonna Be Okay. And she has a program, the Get Unstuck Program, which are resources for parents to actually improve their children's symptoms, because it's a scary world out there. It's a very tough world. And she's been featured actually at dozens of media outlets, Fox News, CBS, NBC, Parents, the New York Times, and so much more. So thank you so much, Dr. Roseann, for joining me today, because you literally are providing hope and healing to so many. So I can't wait to talk to you today. Yay!
Well, thank you, my healer sister, Dr. Mejia. But this is a trying time for so many families, right? And it's been going on long before this pandemic, as you already said, right? And people don't know that there are alternatives to psychiatric medications. I think that's something, right? We talked about psychiatric medications, antipsychotics, ADHD medication it's almost easy to get ADHD medication. You just have to say your kid is having a hard time focusing. And we think it's safe, but 100% of the time, there is an adverse reaction to to ADD medications, 100% of the time. So some of those symptoms may be mild, maybe irritability or food restricting, but sometimes it can be rage. I've even had many clients have psychosis induced from ADHD medications. It's not that abnormal, right? Wow, because, we get complex cases. Yes, I see people that are simple. And when I mean simple, like my kid's having some anxiety, we want to have him talk to a therapist and, learn some skills on how to cope with stress. Yes, I do that. But the norm is kids who have autism, anxiety, eczema, irritable bowel, and then beyond, have tried 7 or 8 psychiatric medications before they get to me, right? Is that the same with you, Medea?
Same, exactly. And remember, we're not saying one thing is good, one or the other, all or none, right?
Yeah.
But the thing is, you got to weigh your risks versus the benefits for every situation. And there's so much more that we can do besides the pharmaceutical treatments. And that's where we're going to dive in a little bit more about today, because there's so much hope out there.
So much. And parents just don't know. Like, people come to me every day and they're like, wait a second. If neurofeedback was so great, why didn't I hear about it earlier? And then, I have to explain, if changing your diet and adding more fat was so great, why didn't my doctor tell me? Why didn't I hear about the specific type of psychotherapy for OCD? Well, ultimately, in the end, the people who are giving the information, typically physicians, mental health providers, they don't know it either. They're not looking to research. So, we are research nerd ladies.
Absolutely. I love that. Research nerd ladies.
And, I was doing research when it was on microfiche people. And, when I found neurofeedback, literally I had to go to the belly of the basement and look on microfiche. For those of you who don't, you're probably all old enough to know what that is. But, my book, It's Going to Be Okay, has over 40 pages of research citations, because I want people to trust this information. I want them to understand there is not just one other way. There's a lot of other ways to reduce symptoms associated with mental health, distress, dysregulation, whether it's behavioral, emotional, cognitive, social dysregulation. You can help your kids, and it doesn't have to be a pill. What I do want to say is, should never start with a pill. We should always start with these science-backed natural treatments first. Before we do that, we're talking about developing brains, right? And these things, as you said, can damage the body and damage the brain, right? Long-term usage of psychiatric medication can shrink the frontal lobes, can reduce the volume of the brain. And sometimes these things are recoverable, and sometimes they're damaged. Some of these kids that I've seen have psychosis had lasting cognitive issues as a result of medications. I've had numerous kids have cardiac problems, at least temporary, from ADD medications. And, we can't minimize that. We think it's safe, and then we're afraid to trust these science-backed natural tools, techniques, methods that parents just don't know about. And that's what we're doing. We're partnering right now, letting people know there is another way, and you need to have hope, you need to believe. Because the moment you stop believing, you go down these medication routes, right? And I'm not seeing people, I don't think you are, where they're trying medication and bam, slam dunk, they're doing great.
It's harder because we see those end case scenarios, but it is really hard. And I mean, I get the ones that are on these medications for long terms, because I see these chronic cases, and it's really disheartening. I mean, it may have even helped some of their symptoms, but the child is no longer really that child. Like it's blunted a lot of their emotions. There's a lot of other adverse effects that have occurred because of that. And that's what we want to try to avoid, and to show people that once we can get to the underlying root cause of why your child is dealing with those symptoms to begin with, because that's the difference between conventional care and holistic, functional, integrative medicine, is where we're asking the question, why did your child immediately turn this way? Or why is your child dealing with anxiety? Or why is your child, dealing with these intrusive thoughts? Why is your child? So we're asking the question, why? And we're trying to figure out the underlying root cause. And so because once you improve the underlying root cause, you can improve not one of these symptoms, but then all of them simultaneously. And I know you've discussed that a lot in your book, but let's first start with your story, because this is not something that you just woke up one morning and decided to write about.
No.
I want to hear your story.
Yeah. So, myself, I wanted to be a mental health provider because when I was 5, my friend's mom, Angela, in Italian, asked me what I wanted to be. And I said a psychiatrist. And then I realized that that's somebody who does pills. And I changed it to be a therapist. So it was always my calling. And, I have been in mental health. This is my 30th year. And so when I was in undergrad, I already started working in schools and psychiatric hospitals. I wanted to get in there and start working. And I quickly realized that, there were, even then in the early 90s, very distressed kids. And what I saw was that even small interventions could have a huge positive life impact on these kids. And I said, I really want to work with kids. And no matter where I was, whether it was a psychiatric hospital or a school or private practice, I was seeing over this time more and more layered cases, kids that were trying, working with great therapists and not making any progress, going to a great psychiatrist who was trying their best and things were worsening, and families in complete distress and only worsening, and just seeing a rise in anxiety, like unbelievable. And in the same time, a dramatic increase in autism. You talk about it getting to that level. Right now, 1 in 37 boys has autism. So virtually in every class and a half, you've got a kid with autism, right?
That's craziness. And we've never, they say, oh, it's just better diagnosis. But where are the autistic kids that are my age, that are your age, that are walking around?
Yeah. Oh, and it's terrible with diagnostics. American Academy of Pediatrics took 12 years to update the pediatric guidelines on autism, right? And for 12 years, it's just skyrocketed. And they didn't have information on there like these kids have sleep problems and sensory problems and often have bowel issues. Like they didn't even have this information from pediatricians. Can you imagine how many kids were even missed beyond that? I mean, there's so many reasons. So the kids I worked with really brought me to this. And, you made me think about a boy named Alec is who got me to neurofeedback. Before that, I worked with a kid. We started to do private practice work, and I was working in a school as a school psychologist, and the teacher started to say, will you test my kid? You're the only person who figures things out, right? Because one of the things when you're functional, like Dr. Medea and I, we connect symptoms, right? So we don't just say, oh, here's this and here's this, go to this specialist. So I was working with a young man who was 15. And I was testing him, and his mom was a nurse. And this was so long ago. And he's fully a grown man. And, I had him. And when you do psychological testing, when you do testing for learning and processing, it's chunks of time, like 2 hours or whatever. And the first day he was very charming. The second day, it was like a different person showed up. And then the third day was like a totally different person. So I go out, right? And anybody who knows me is I'm a straight shooter. So I go to his mom and I said, is he on drugs? And she said, it's physically not possible. I urine test him and sample him because I've wondered myself. So I was like, let's talk on the phone tomorrow morning. something is not right. He does not fit into any profile I've ever seen. I do not believe this is multiple personality disorder. Not that anybody was saying that. Something's not right. So I was like, let's go back to the early history. Let's look at everything. 5 years old gets a really rare bone infection. And then just weird stuff. And I said, do you think he could have Lyme disease? I mean, this was like 25 years ago, right?
Wow.
And I said, at that point, I'd had my first case of chronic Lyme disease. And I said, I had this kid when I was working in the schools, and he had all these weird symptoms. And they said he had chronic Lyme disease. I'd never even heard of it. And he had a port for antibiotics, because in the 90s, they would give you a port. And he had separation anxiety, sweating. He was anxious. He had all these sensory problems. He had all these learning problems, even though he didn't have it. And they kept trying to blame the mother, that the mother was quote unquote crazy. And I was like, wow. So let's fast forward to this boy, right? And his mom said, yeah, I think maybe he might have Lyme disease. And so we live in an area where there's these top experts in the world, and she goes and she finds that that's exactly what his mental health problems were the result of. I mean, there were so many symptoms that were like flashing. She spent, I don't know how many, they continue to try to work on his Lyme disease. He is not fully cleared of his Lyme disease. But at least he didn't go down people were like, he should be in a psychiatric hospital. He should do this. She got medical treatment and his symptoms did get better, but he had it for so many years. They believe he had it prior to age 5. And 25 years ago, the treatments, I don't want to say we're that dissimilar, but he really catapulted me to understand that there was so much more than face value. I could have said, this is a kid, he's got like schizophrenia. He's got multiple personality disorder. I could have said something else. Instead, I said, hold on, something is not right. There is something, let's try to connect the dots by looking backwards, and then let's try to get a functional approach. Let's try to get lab work. Let's try to, do some different things. And that really was one of my earliest cases of kids. And then I proceeded to have other very, very complex cases from kids who were diagnosed with ADHD, autism, other Lyme cases, and more, I don't believe everybody has infectious disease, but more and more I'm seeing cases with PANS and PANDAS where there is an infection or a toxic trigger that is impacting kids' behavior, their cognitive functioning, and mental health.
Wow.
Yeah.
Wow. It's really scary stuff. And we're seeing a lot more of this PANS and PANDAS.
Yes.
Can you dive into a little bit about what that is, what those symptoms are? Because a lot of these kids you talked about the infectious causes.
Yeah.
It could be one of the things that these kids could be struggling with. So have it on your radar. So can you dive into a little bit more what that is?
So what is PANS and PANDAS and autoimmune encephalopathy? They're all different disorders that have the same trigger. So it's an infectious or toxic trigger that the body then has a misdirected immune response, produces a ton of inflammation, and then can cause, in PANS and PANDAS, a sudden onset or a worsening of a pre-existing condition, moderate to severe worsening. And autoimmune encephalopathy is a mild worsening and up and down, a waxing and waning. There can be some high level peaks later on, but the initial onset is not a moderate to severe peak. And so you can see everything. I talk about it, as being, having internalizing and externalizing behavior. So you can see everything from anxiety, intrusive thoughts, crying, to the extreme of rage and anger and psychosis, and then sort of everything between, as well as regressive behaviors, a loss of bladder control or frequent urination, and then a loss of learning or motor skills. And then some of the hallmarks are separation anxiety. Not everybody has it. You can see tics, motor or vocal tics. You can see OCD. You can see food restricting. You don't have to have OCD to have PANS, but it is definitely a common component. I would say that I don't think I've ever met a kid with PANS and PANDAS who didn't at least have anxiety. This is a stressful condition. And we used to think it only started when you were a child. Now we know you can have adult onset. I've worked with so many people with adult onset, particularly from tick-borne illness, again, because of the area of the country they live in. But I work with people all over the world. It's not uncommon. And now we're talking about 1 out of 150 to 200 kids have PANS and PANDAS, and they're frequently misdiagnosed. They often have a diagnosis of ADHD, anxiety, depression, or bipolar. Rosalie Greenbaum is a psychiatrist in New Jersey. She did a research study and found that 89% of people in her research study had one or more tick-borne illnesses who had a diagnosis of bipolar.
Wow.
So 89%
had diagnosis of bipolar.
Yes.
But actually had a tick-borne.
One or more tick-borne illnesses.
Oh my God.
She's amazing because she's an older psychiatrist, and she had been practicing for I don't know how many years, 30 plus 40 years. And she saw one kid get dramatically better with bipolar on antibiotics. And she said, what is going on here? And I just think my heart goes to somebody who says, wait, I've been doing this and I see this. Wait, I got to look at what I'm doing. And so she really dove into Lyme disease and realized, wait, a lot of my clients have this. Why am I not at least testing them for Lyme disease as a standard practice? And she did a research study and found that 89% of her population. And the great news is this. The treatment isn't psychiatric meds. The treatment's antimicrobials. And these kids got better.
Wow.
Right? So as you said, such a dramatic increase in psychiatric meds. I rarely meet a high school kid or a college kid not on a psych med.
Rarely. I know, 400% increase. Like, that's craziness. Yeah. So if this is a pharmaceutical issue, if this was like an SSRI deficiency, then why aren't these kids getting better? Because alongside with that, rise in pharmaceuticals that we're giving out, candy in some situations,
like candy,
exactly, and the rise in suicide, the rise in mental health issues, the rise in not even just that. Now, health aside, every 7 minutes, a youth is getting arrested for drug crimes. Some kids in the next 24 hours, at least 1,500 teens will use drugs for the first time.
Yep.
They said during this pandemic, the Children's Hospital Association and the American Association of Pediatrics found that nearly 20%, there's an increased 20% spike in young people attempting suicide and a 40% increase in behavioral issues. Now, that is a lot of children.
It's a lot. And it's not just a U.S. issue.
No.
This is a global issue. So the U.S. mental health compared to like Europe used to be far worse. Europe, these hospitals, policemen, they're all crisis components, right? Most policemen are spending about 50% of their time dealing with people with mental health issues. 50%.
50%. Wow.
50%. So, we're not putting the resources. I mean, you talked about 1 in 4 kids in 20 years having autism. There's not enough money to support these kids educationally.
No, what's going to happen to our future?
Right.
Like, what's going to happen to our future? Like,
exactly.
So it's so scary. Yeah. And that's why me and you are so passionate about this, because we see that tidal wave coming. Right. And we're like, we got it. Like, wake up, people.
Well, if we're able, Amazon, my original subtitle, my book, It's Gonna Be Okay, it was supposed to be called Proven Ways to Reverse Your Child's Mental Health. Amazon made me remove reverse and put in improve. Okay. Even though 40 pages of research citations, and it's about reversing symptoms. There are symptoms that can be changed, right? So what we are doing is letting people know there is another way.
There's another way.
Safe, You know, everything we talk about, you're not going to be harmed from giving your kid an avocado.
Exactly. There's no drug interactions of giving your
drug interactions with that. Is this safe? You know, people come to me and they're like, is neurofeedback safe? I'm putting something on my head. And I'm always like, you're on Xanax and you're popping it like candy. I mean, what are you so afraid of? And they're like, well, that's because my doctor. And, you know, I've said this to you before, right? Here's our pyramid, our health pyramid. And on the top is the psychiatrist or your physician. You need to kick them out. You need to be on top of there because you can get this information. And I encourage people, well, you should buy our books because we've done the research for you. But, you know, I was talking to Daphne Oz and Hilaria Baldwin, and they were like, what do you think about Google? And I'm like, everybody should use Google. There's information, even though it's, you know, some of it's been altered, depending on how much money you take from Big Pharma, because they do accept payments to reduce words like natural and 5-HTP in 2019. $900 million they accepted for those two words. So, but people need to be empowered that there's valid information, there's scientific research. The scientific research says, you know, what we talk about, nutrition, sleep, genetic mutations, which is why another major reason why we're having such a rise, you know, these are things that can be addressed safely and effectively, right? So why aren't we using them? Right? I just believe people don't know. They have to kind of find us when they're in a hole. And I just don't want people to be in a hole anymore. And, you know, it's hard having a kid with autism. It's hard having a kid with ADHD or PANS or whatever it is. You absolutely can at least make it better by using evidence-based natural therapies. You absolutely can. And there's a la carte menu of things that are really effective. We don't always have to go to the one thing, meds, because we think it is a magic pill, because these things are not, and they come with a lot of baggage. And you're right, it dampens you. And it doesn't mean you're going to learn, right? I think people think I take a pill, my kids focus, so they're now going to turn in their homework. Right? That's not how it works.
That's not how it works.
No.
And, just to clarify, everybody, that the doctors or the psychiatrists, the doctors that you go to, they're not like evil, that they're just trying to, you know.
No.
But we just don't know.
They don't know.
Doctors, us as doctors, I literally have almost every doctor in my family, like psychiatrists at Harvard, to all of these other specialties. It is crazy that we were never taught a single class of stress management. We were never taught anything about food or lifestyle. We were only taught, here's a problem, here's a pill, a surgery, a procedure that we need to address. My husband has to see 110 patients a week for our paycheck not to go half. So 110 patients. So in that amount of time, doctors are never taught to address the underlying root cause, because that does take time to try to figure out where the person's individual root causes would be. Plus, on top of that, we get paid for how many patients we see, not how many patients we heal. And so this is just a system that we were just never taught. So I want you guys to take Dr. Rosann's book. Take all of our books, take this to your doctor and help educate and empower them. Just like for me, patients did with me years ago, like 12 years ago, that literally changed my mind. But if your doctor is like shutting that door and saying, sorry, that doesn't make any sense to me, like listen to go find a different doctor.
Well, you're talking about it set up as a sick care system. And, I have a case where many years ago, there was a physician in my area that saw a lot of kids on the spectrum, on the autism spectrum. And so we had a lot of shared patients, and she would tell the patients, I don't believe in neurofeedback. And the mothers would say, well, I'm going to do it because we don't have nothing else to do. right? And my friend Betty and my friend Mary and my friend Jessie and my friend Marty all told me, this is where you go. And so a number of years went by. I want to say about 7 years went by. She called me up and said, I want you to come to the office, do a presentation on neurofeedback. I brought my equipment. And you know what she said to me? I said, thank you. I know you were opposed to this. And she said, well, you changed so many lives that I had to find out more. And amazing. But those mothers went in there and they were like, you didn't talk to me about an anti-inflammatory diet. You didn't talk to me about how this could work. And they were the ones pushing, which is what we do. I believe in the ripple effect. Like, I'm asking every person to tell 5 friends about this book. There is not one person who does not have stress right now in the pandemic. And even if your kid is emotionally healthy in general and doing pretty well, and they're experiencing stress, you need to have this information, because this is going to help stress inoculate your kids so that they don't develop anxiety, they don't develop depression. This is an overwhelming time for people. And not to say that some kids aren't actually thriving during the pandemic because they're loving homeschooling and they're getting hot lunches and all this good stuff, right? But
my kids stay in my pajamas all day, so they only change from up here up. And I was like, so they love it. They want to go back to school? No, why? We love the pajama days.
I know, right? So, there's so much to be done, and you do have to push, and you do have to try to find the right support, and you do have to tell your physicians. I do find, Medea, that a lot of these providers, they're getting this information because their own kids got sick, right? You know how many physicians or pharmacists bring their kids to me? And, in the old day when we had the waiting room, it was filled with cops and teachers' kids, because they were like, I'm not putting my kid on a med. And you're right, these things, we talked about drugs and at-risk behaviors. What happens to somebody who doesn't feel good about themselves? They're going to do things that are dumb, that are going to get them into trouble. Okay. And in today's age, this is not the 70s or 80s or even 90s where you could do some dumb things once in a while and you had a little bit of rope, right? You had a little bit of leeway here. This is not what happens today. Everything is filmed, criminal activities, even if you just make a simple mistake, it could be interpreted as criminal. And, when you don't feel good about yourself, you're going to make choices that are risky. And these things can haunt our kids forever. And more importantly, we want our kids to feel awesome. We want them to feel confident. We want them to be successful. And what that success means is maybe it's just being like the nicest kid in the world. Maybe it's being beloved by your teachers, or being a great artist, or you're great at baseball, whatever it is. Maybe it is being a straight B student, whatever it is. And, it all starts with inner confidence. And when your kid is struggling, when they're highly stressed, or they're emotionally dysregulated, or behaviorally dysregulated, or struggling making friends, I think parents are seeing how important social emotional development is in this pandemic. And they're starting to realize those grades, which were the benchmark for mental health, are meaningless.
Yeah, they are. Because the kids are still getting sicker. Our kids' brains are getting sicker. And that can lead to destructive behaviors and make you lose your mind. Let's put that added bonus, because parenting children that are there when their brains are not working properly are very difficult kids to parent.
They are.
And there's so many things in your lifestyle that is actually, there's 2 main pieces of your decision making. It's your prefrontal cortex and your amygdala. Prefrontal cortex is that making the rational decision making, while the amygdala is irrational, like we're just fight and flight type of decision making. And so there's a lot of things in our children's environments that are disconnecting our prefrontal cortex to our amygdala. And it's leading to these irrational thoughts. And those kids are really difficult to parent.
They are. They are.
Yeah. And so that's why your book is critical in that. So let's dive into how can we have these children that are difficult to parent? We have these kids that are struggling. what can we do? Where can we start? And how can your book help us with that?
Yeah. Well, first of all, I'm going to say there's no limits to what we can do. Okay.
Wow. Hope.
How about that? Okay. And I don't want to hear that your kid can't get better, because that's not true. So number one, you got to believe and you got to have hope. And don't put a but. Don't say, Dr. Roseann, but. I don't want to hear it. I want to hear, and how do I do it? Okay. So you've got to hold that vision for your kid. You have to get off this worry train, and you have to be present in the moment. And I do dive into parenting. I talk a lot about the different ways that we can build resilience and grit and success for our kids. And it's in those little moments that just build over time that your kids learn to deal with stress, find ways to problem solve, learn how to be uncomfortable, learn how to go through all those emotions of being angry or sad or worried, whatever is going on. They learn to tolerate that. So building stress tolerance is really important. But my book, It's Going to Be Okay, is all about these 8 pillars that really have a lot of science behind them to give you the step-by-step way of approaching whatever issue is going on with your child. Now, some people are like me. We want to jump in and we want to hit it hard from multiple angles. And certainly if your kid is in full-on crisis, we're going to have to hit this with multiple angles, because it's multifaceted. You can't hit a multifaceted issue with one treatment. You can't. And it requires the synergy of these natural treatments. And I include psychotherapy as a natural treatment. It is an evidence-based treatment. It's just got to be the right type of psychotherapy at the right time. You know, as Dr. Medea just said, you know, when your frontal lobes are not working, your amygdala, and I also throw in the occipital region in there, you know, your frontal lobes are your braking system. So you've got a Ferrari, right? And you've got a 1983 Hyundai braking system in there. It ain't going to work. Okay. People come into me all the time. They say, my kid's got 131 IQ. And I'm like, they don't get along with one single person. They don't know how to clean their room. They eat 5 foods. And they only say no. They never say yes. And everybody walks on eggshells all around your house. What is that 131 IQ doing for them? Nothing. Okay. So let's get back to that, right? So, you know, we have to focus on that, and learning how to regulate your brain and body and how to connect is the basis of good physical and emotional health. And if you don't have those things, your kid's not going to be successful. They're not going to achieve. They're not going to go to Harvard. They're not going to do all the things. And if they get to Harvard, they're going to flunk out because they're going to have a breakdown, right? And so let's back it up. Let's do what works. And so I show people, I give them the tools, I tell them the stories, and I help them through that process. And, you know, most of these things you can do on your own, right? Most of these techniques and tools you can do on your own. Okay, you got a clinical issue. Your child absolutely has ADHD. You've done, you know, 90%. You've done all these things, and your kid, it's still not within a healthy range. Okay. Still struggling. Okay. Well, let's try some neurofeedback. Let's try some PMF. Maybe it is time for psychotherapy. Yes. Okay. There's nothing wrong with that. These are evidence-based approaches that are safe and natural and work. So it's really educating you about what are the common sources and what exactly do you do. It's really your roadmap for good mental health. It's designed for parents because we are really people that are trying to help families, but this is the same for if you're 73 or your kid's 3. These are the same principles, right? The principles of health are the same. It's just that I really dive into parenting and how you can parent in a way that takes less effort, right? And you're going to get a lot more yeses, right? Because our kids are not hearing us. They're not taking action. And boy, it's like a friction point. and a lot of homes, you know. And your kids, again, kids are not most of the time doing these things on purpose. It's the way that their nervous system is acting, and they're just not able to take that action. So let's do things to regulate their nervous system so that they can feel good about themselves and they can take action. They can pay attention. They can be calm. How about not be snarky?
Yeah. And it makes a big difference on our mental health.
Yeah. Hello. I mean, you know, when my older son has PANDAS, and, you know, for like, you know, he's 16 and he got it at 22 months, and he's a no kid. Just expect him to say no. You could be going on a Disney World vacation. We couldn't tell him until the morning of, because he would freak out. He would love it when he was there, but he's such anticipatory anxiety. He would make it so difficult for the rest of us. And, you know, at about 15, really started to not say no. And, you know, you can see he's uncomfortable. He's just learned to build those skills. Like, it wasn't an overnight process. The poor kid has like 8, 9 tick-borne infections. But, you know, it takes work, and it's really hard when you have a kid that is challenging. And, you know, we bring a lot of humor, we bring a lot of fun into our family to diffuse situations. I know what it's like when things are tense, and it's hard. It's hard. It's hard on your marriage. It's hard on your family. It's hard on the people around you. And friends, when you have a kid who's an externalizer, they don't want to hang out with you. No. You know, they're afraid, you know, and you're going to get social rejection. Even Dr. Rowe has gotten social rejection, break your heart social rejection from people that I would have never expected in my life. And so, but the people that are there, hello, they're supposed to be there. So this is hard on a lot of levels. And I think even just the constant worry that parents have, it's rough when you're up in the middle of the night and you're like, tomorrow's field day. What's going to happen? My kid's going to be obnoxious, or whatever it is, or are they going to have a meltdown because he didn't get the blue balloon? Or, you know, these are the kind of things that you stay up and worry about.
Absolutely. Because I hear a lot that, these lifestyle changes, these stress management things that we're teaching them, it's too difficult. I'm like, it's not that what you're dealing with is difficult. This is not difficult, because at the end, if your child's brain starts working properly, they turn into a completely different human being, like a human being. Because now they ain't human. They're like, because I love what you said before. These kids are inherently good. All kids are inherently good. They don't want to cause destruction or disappoint or be difficult.
No, it's like watching the Hulk, right? Yeah. So Bruce Banner, great guy. And then you see it come in on them, right? You know what I mean? My younger kid is a yes kid. And whenever I see him getting a little off, I'm like, is that the Hulk coming out? And he cracks up. But that's exactly what it reminds me of, because they're fighting it. They don't want to be this. And then, you know, everybody around them, it's very traumatic to have a very behavioral kid on a lot of levels, even for them, right? And not every kid is outwardly behavioral. We have our inward behavioral, and some of these kids can be very high performing, straight A students, but just be a hot mess in the inside. They might need a lot of reassurance. You might have to do coaxing. You know, I've had a lot of kids over the years where the parents were like, this kid is so great, like so enjoyable and this. And then I get him in a group, or they're at a birthday party, or they have to take a test, and they're so just fraught with worry. And I don't want them to be on meds, and I want more for them, and people will come and just the change that happens to them. And they'll say, like, they always tell me they laugh now in public, they hug more, you know, things like that. That's what we want for our kids. We want our kids to just feel really good. And when you feel good, your kid has no limits. Talk about what they can do in life. You know what I mean?
Absolutely. Right. The sky is the limit.
Look at your kids. They're interviewing us on podcasts. You know, they're like pros. They don't know that they can't do something. right?
No, they don't, because
No.
but the thing is, it wasn't always like that, right? And that's what I wanted to tell people, that I have also been there, done that with these kids.
Right.
And it's been a long trek. I mean, obviously I've been learning this slowly but surely, because I was not taught this in residency. I was not taught this in medical school. And I had to learn this. So as soon as I would learn something, I would start to implement it. So it was a slow change.
Yeah.
And I remember my 10-year-old, I mean, now he's 10, when he was like 5 or 4, he threw the biggest fits. Like, I would just assume that it was miserable. I would just assume that at least 3 times a day, minimum 3 times a day, for at least 2 hours at a time, at each time he's going to have a temper tantrum over something. And if I'm taking him out, if I'm going to, wherever it was, he was just screaming, throwing fits, throwing stuff. I mean, he was so erratically behaved. I mean, this is just his decision making. He even tried to hang himself.
Yeah.
Can you imagine? Like, he was just, I'm like, what are you doing? Like,
he went into the red, right?
He went into the red. I'm like, what are you doing? And that's what I'm like, this is just not normal. You are having a child trying to do this at such a young age. And now it took time. I had to make these changes, these lifestyle changes.
And now getting him to deal with stress and finding another solution when you're frustrated. You had to make little changes here and there, and they all just add up, right?
They just all add up. Yeah. And it's all about empowering them, and it takes time, empowering them with these simple lifestyle tips. Yeah. And then just like life skills, right? We're teaching them how to, wash their hands after they go to the bathroom. And why can't we teach them how to breathe? And I know you guys a lot
absolutely
with your book.
And especially that so many kids are just at such a pain point, right? Like you talked about, I just accepted he was going to have multiple tantrums in a day. I'm going to accept my kids got ADD. I'm going to accept my kids got bipolar disorder. Why are you going to accept the symptoms? So in my book, I really break it up, in these digestible chapters about what we can do when this happens. This is what you can do. We go into parenting, we go into these evidence-based, brain-based therapies, right? Because people don't know about the power of things like, using biofeedback or neurofeedback, which are devices to help regulate your nervous system. And neurofeedback is more specifically your brain waves, and how these things are decades and decades old, tens of thousands of research studies, and people all over the world, or providers all over the world. And you can use these things and have lasting change where you don't have to be on medication for 50 years. No. So you could do neurofeedback for 6 months. People are like, oh, this takes a long time. Wait, so for 6 months you do something, maybe longer, maybe less, but let's say most people are doing that. And you're going to create lasting change that's going to last for decades. Really?
It does. Yeah. It's so powerful. So powerful.
So powerful.
Because in the residency that I went to in South Bend, Indiana, we actually I was very blessed that we had our the head of psych, whatever, their psychotherapist, PhD. He actually used to do neurofeedback, and we actually did rotations with him. And just to see the benefit, seeing people before and after, so powerful.
So powerful.
So powerful.
Yeah. So I love to see what unfolds in people's lives when they make these changes. So I've been doing this for so long that, people even brought me their kids, and just to see what happens to them, because I don't really get people back. I only get messages or things like that. Sometimes I get them back when they get a head injury, but that's a whole other story. But
I don't get many people back either, so which is good.
Which is good. I want them better. I'm like, drop me a line, let me know. I used to see people out, but you don't see people out anymore. And so, we have to get this message out to people. People are shocked. What do you mean? What are genetic mutations? Oh, that sounds terrible. No, it's something that is treatable. I mean, mutations are things that we can use. Where there are supplements, there's lifestyle changes, and there's direct implications for mental health. People are not aware of this. And you need to know so you can better the health of your child. And, things like medications or, ineffective therapies that are not working, Why? Stop going down the rabbit hole and look at the research. And that's what I've done. That's what's in this book. It's laid out for people in a really easy, digestible way that you can feel good about. These are safe things that you can take action on. And there's nobody who can't do the majority of these things, right? The first 6 chapters are mostly lifestyle changes. You know, in there, how much sleep do you need? What does that look like? What's sleep hygiene? You know, different things. And so really, really helpful and surprising in an awesome way. And I just want people, as mom with 2 special needs kids, a dyslexic and a kid with Lyme and PANDAS, it's going to be okay, right? So that's the name of this book, because that's what I tell every parent when they come to see me. It's going to be okay, because I know what it's like to be on the worry train. I want you off, and I want you directing your energy to things that will create change for your kid and your family.
And I love the title. It gives hope, right? It gives hope. It gives you positivity, because most parents that they take their kids or something off with their kids, they take them to the doctor, they don't really offer that much hope. They're like, so sorry, this is what you're going to be stuck with. They're on this medication for the rest of your life. This is just your new normal. Yeah. And so here you've offered so many, just in your title alone, you've offered them so much hope that there is so much that we can do. We have so many tools in our tool belt to get your children back.
Yeah. And to see them be successful in so many areas, thrive. And, you know, I just want parents to have that hope within themselves and you know, not to be just so sad. I mean, our kids should be celebrated, you know, absolutely. I mean, I call my second John Carlos special needs because he's got dyslexia, but hello, he could be president of the United States, this guy. I mean, I'm marriage offers right now if anybody want to write me in. He is amazing.
Wow.
I can't even tell you, every year at least one teacher writes delightful on his report card. I mean, I go to heaven right now because that's all because he's a sweetheart. He is a sweet, sweet boy. I mean, he can cook like it's nobody's business. So
wait, now I got to get some tips, because we're working on that piece of it.
He did last show when he was 5. So, you know, we have to celebrate our kids' gifts, right? Does he get a little ornery? Today's Wednesday. His tutor's coming over for, you know, his reading tutor for dyslexia. Yeah, I say, is that Hulk coming out? And we have a laugh, and I say, hey, mommy didn't get her PhD overnight. You got to put some work in, buddy. And, you know, we have our little banner and stuff. But we have to celebrate. If I focused only on his reading, that kid would be miserable. He's the freaking, I call him personal sunshine. He's my walking sunshine. And so we have to celebrate kids. We have to think differently. We have to focus on the things that create change. And there is no magic bullet. This is my magic wand. Yeah. And, you know, that's what this book is all about. So thank you for recognizing that it's hope. And I just want to give that to parents, because I know what it's like to feel like, what am I going to do? Right? Yeah. You know what I mean? And so this information is here. It's for you, and it's laid out, and every parent can, you know, get this book. And certainly if you're here and listening and you have a friend that you think could benefit, please tell them, because we all need to, I'm on this mission to change the way we view and treat children's mental health. And we need to tell people. And the way to do it is not to be like, hey, your kid Freddie has a raging case of ADHD. You can say, hey, I listened to these great ladies and they were talking about family health, and I bought you a copy of this book because I think there's such cool stuff. I bought one for myself. See how nice that is? And, you know, who's not going to love you? Make this your book club book, you know, and just get it out, because there isn't one person that's not struggling right now. There isn't. There's somebody in your family who's got some stress, and these are actionable tools and tips and healthy things.
Oh my gosh. So amazing. Let's go ahead and take a couple questions. Do you say you have time for a couple questions? Yeah. So let's start here. So I have this. She has twin boys. One is thriving in school socially, and the other one is the total opposite. Yeah. Is he just a slow learner in school, or is this normal?
Well, they come out the way they come out.
Yeah.
And, you know, I mean, here's the thing. So when I hear slow learner, right, would I be concerned? So, twins have a higher rate of clinical issues because of the enclosed birth environment. So was this a natural birth? Did something happen? So I would want to look at some things, but also too, maybe their strengths are different. Maybe one is an academic and maybe one's an artist. Maybe one is socially gifted. Let's start looking at the different kinds of intelligence, right? But if you're concerned, don't compare your kid to the other kid who's an easy learner, right? Talk to your kid's teacher and say, where does my kid fall in this class? Okay, you got 20 kids. Where is his reading in this class of 20 kids? Where is his math in this class of 20 kids? That's going to be a lot more telling. If they tell you that they're in the bottom 5, you got a problem. Okay. They tell you he's like, 5 to, 12, he's fine. Maybe his brother is number 20. Maybe he's the top dog. So you can't compare your kids. But if you see a struggle and there's a frustration behind it, there's probably something going on. And you might want to, the first place, if it's learning only at school, that's where you want to look. If you're having learning challenges at home, you want to start with things like putting visuals up. Maybe he's got an auditory processing problem. Do you have to say his name 3 times? So you want to practice with what's going on. So start there, ask the teacher. If you have other concerns, find a psychologist who specializes in learning issues and see if there's some hacks and things you can put in at home.
Awesome. Beautiful, beautiful, beautiful. We have another from a freebie, a 10-year-old boy with behavioral issues, mainly repetitive talk. Yeah. How can they help him respond positively?
So repetitive talk, I'm assuming you means he's not echoing. It's not autism and he's echoing. Okay. So I'm assuming that he's just repeating things, maybe being annoying. So correct me if I'm wrong, but I'm going to go with he's repeating things like, maybe saying inappropriate things and then not knowing when to quit it. Right.
Yes,
so
absolutely.
10-year-olds are starting to play out and get a little more autonomous. Right. So there is something called ignoring. And one of the best things you can do with behaviors is ignore and reinforce the heck out of the stuff you want to see. So I like to you can break any behavior, most behaviors, 99% of behaviors you can break in 10 days. Okay. So what you want to do is catch them with attempts towards that behavior that you want, right? So when our kids are struggling, the number one parenting mistake is we actually reinforce the negative that we want. Don't say that, we say to kids. Well, they don't know what to say. So what we would say is, hey, Fred, do you know what else we could say? He might say no. So you might want to say, okay, the thing, instead of smacking your sister in the head, why don't you say, can I have that? Okay. So the next time, gotta have your eagle eye on, you see your kid, it's going down. WWF is going to go down between your siblings, right? You want to be like, Fred, you came up with that great idea to ask your sister last time. And he's like, okay. And he says it and you reinforce that out of it. Reinforce. And you want about 10 days, like ridiculous amounts of reinforcement because they don't know what to do. That's how you do it. Don't tell them stop. It's called negative reinforcement. You're actually going to increase the likelihood they're going to be more annoying.
Wow. Here we have another one from Sumera. How do you deal with mood fluctuations and teenage girls attaining puberty?
Yeah. Well, it's it's the same thing for boys, right? Whether our kids are having that. So first of all, you want to have a really good diet, okay? And you want to eat foods that balance your blood sugar. So hormone fluctuations a lot with girls is they can be, having like diets, sodas and junk food, and it's going to do a number on your hormones. Okay. If your girls are active, get them moving. Okay. But you want to have great conversations with your kids, right? So, when my oldest was in puberty, in the big part of puberty, I was like, mommy's in perimenopause. and you're in puberty. Some days it's going to be like, and he's like, oh, but I was like, listen, here's the deal. And so we would talk about it. So I was like, look, mom's hormones, your hormones are through the roof. Mine's going down. It's going to be, we're going to tangle. And I really brought light to it. And this is a kid that's not easy. And I made it much more understandable. So I was like, look, you're having a hard time right now. Like, when he was calm, I was like, what makes you feel better? When I have meat, when I have steak. This is literally a conversation. My kid's like, I need meat. You need to get me more meat around the house.
Yeah.
And pre-made stuff. So have conversations and solutions they think are helpful without criticism. But really doing that. And also too, there are supplements. I have a lot of supplements in my book for mood. And you can look at supplements to balance out. I'm a huge fan of magnesium, and make sure your team is getting some sleep. You don't sleep.
Forget it. Yeah.
Forget it.
The Hulk will come out a lot faster.
The Hulk will come out, and God knows what he's going to do.
Destroy. So let's just go one more question, if that's okay with you.
Sure.
So it's a little bit bigger.
Okay.
What resources can you suggest for someone who's diagnosed with high-performing autism at age 16? His minor behavioral issues were seriously ignored since because he was with the same set of people since the age of 3. The problem was identified when he was changed schools in high school, and he was severely bullied and dropped out of school.
Okay. I'm so sorry he was bullied. I was bullied when I was a kid too, and it's hard to get over. So we're going to address the bullying, but first I'm going to tell you, you need to it's going to be okay. You need to do the things that are in here, and you need to try to really get his nervous system to regulate. It's really important. When I do QEEG brain maps on somebody who has autism, it doesn't matter what level. Okay. And high functioning means you have good cognitive skills, but no matter what, social skills are impacted in autism. Okay. And it's this belief that if you have good grades, everything's okay. That's how these kids get missed. Okay. And there's always a social impact. That's what autism is. So you want to go in, and when you look at the brain map of a kid on autism, first of all, they always have inflammation. Always. Okay. And we know from post-mortem studies that's over 70% of adults with autism have brain inflammation. So it's there, right? Then what you see is, I can see the communication in the brain. You see all this inner chatter, the hyperconnectivity, which means everything hits them hard. There's a sensitivity to there. So their nervous system is more prone to agitation. That's why there's a rigidity to them, because they're always in a hyperdrive. So we want to regulate their nervous system. The second part of this, bullying is traumatic. It is traumatic. And you cannot think that it's not. So I would love for your son to see a therapist who is a specialist in trauma and working with kids. Don't do talk therapy. You need to do things like somatic experiencing, EFT tapping, EMDR. These are really great therapies. Neurofeedback helps you, but he needs to talk therapy. He needs therapy, but it's got to be what we call trauma informed. It will help him. This will be in his subconscious. It doesn't matter how awesome your family is. Clearly, he couldn't finish school. So let's get his brain back online. Let's get him less activated from both being on the spectrum and the trauma. And then let's talk about maybe GED or some other thing. And maybe that's important. And maybe he goes and gets a certification in some other area. There's lots of ways for kids today to earn livings. So I think it's great for everybody to have a high school degree, but I also work with homeschoolers all the time, and they complete their education, but I have homeschoolers that make amazing livings doing things in the digital realm. So don't underestimate how powerful that traumatic impact of that bullying is. He will spend a lifetime trying to escape it when your subconscious is going to bring it up and activate his nervous system.
Wow. Well, on that note, there's so much hope that we can still do.
So much hope.
That even though, despite that he, it was misdiagnosis. I mean, this is somebody who's 16 years old. There's still so much that we can do. And no child, I love that every child can get better.
Every child can get better.
And we're going to like end there because there's so much hope that, you know, we got to get off our worry train. We can get better. We're going to focus on all the things that are going right in these kids' life.
Yeah.
And when you start doing that, then you can recognize, oh my gosh, our child can get better. And your book is a great place to start. You have compiled how many years of research into this?
Yeah. I mean, my 30 years worth of work.
30 years of work.
Yeah.
Absolutely.
It's what people come to see me, or they, you know, work with me remotely. It's everything I do is in this book, you know, and I want people to know that they can do these things themselves. So, Dr. Medea, I love talking to you.
This is so much fun. Again, where can people find you, find more about your information of your book?
You can find me, Dr. Roseann, everywhere. It's ROSEANN, no E at the end. And you can find me on Instagram there. My website is drroseann.com. And you can go right on the homepage and click. And my new book, you can go to itsgonnabeok.com or drroseann.com. And when you pre-order the book, which comes out next Tuesday, you get all these cool free stuff. You get, you know, improving your kids' mental health right now video from me. You get a bunch of downloads. You get 100 ways to cope with stress and how to talk to your kids in a way that they can build resilience and grit. You know, so, you know, there's a lot out there. Just, you know, again, I'm doing this because I really want parents to and kids to not struggle.
Absolutely. And we have a question. Do you work with people internationally?
I have family in Asia right now.
Okay.
We have to work on the time though, but
yeah.
If we can make it work. Sometimes I'm like, no, I'm not meeting you at 10 p.m. It's not
Absolutely. Absolutely. Well, thank you so much. You are light on this planet, giving hope to so many. I am so honored to call you my friend.
I'm so honored.
Thank you so much for everything that you did today. I know this was like last minute, but I think we did pretty well. We just did it. Everybody, please check out Dr. Rosann's book. It's going to be okay. Check out her website. Check out everything that she has. I know she even has like a couple free gifts on there. And so there's lots of resources that she has provided to give hope to no matter where you are, even if you're older. And this can, again, work at any age.
At any age.
At any age.
I mean, people always come to their kids, but then their whole family comes to me. You know how it goes.
Yes. So any age can benefit from this, because can you imagine when we start living in a world where all of our brains are actually working the way they're supposed to?
Everybody be happy and nice. Oh my God.
Can you imagine? Wow. What would you be able to accomplish?
And it would just be amazing. Or you'd say, I need some help, and you'd have a line of people wanting to help you.
Yes.
Right?
Yes. Oh,
amazing, right?
Amazing. So Dr. Rosann's book is the first step. So get that. Let's start to create that ripple effect to create better brains and bodies for now and years to come. Yeah. Thank you again, Dr. Roseann. It's been my honor. I'll see you guys later. Thank you guys for tuning in. Bye.